Miss Tubbs passed her weaning trial and was extubated to a nasal cannula at 2 liters per minute, but immediately became tachypnic and her SATs dropped to 82%. After assessing Miss Tubbs, I believe she was rapid shallow breathing, so I obtained an ABG, which showed an increase in CO2, a decrease in her pH, and her PaO2 was around 50. So her ABG shows a respiratory acidosis with moderate hypoxemia. I notified her doctor of the ABG and my assessment results, and it has been decided that she needs immediate BiPAP therapy. Before starting Miss Tubbs on the BiPAP, I'm going to need to size her for a mask. I've decided on a full face mask just to eliminate and prevent any leaks. Since she is in respiratory distress, we need to try to make sure she gets as much pressure as we have set on the BiPAP without the risk of losing any of that through any leaks. So I'm going to size her for her mask with this guide that is included in all of the masks. And we'll just place this up to her face, and we want it to cover the corners of her mouth and over the bridge of her nose. And the small is too small. And the medium looks like that's good. And we'll check the large. The large is too big. It goes up over her eyes and down to her chin. So we're going to go with the medium face mask. I have Miss Tubbs set up at an IPAP of 10, an EPAP of 5, her rate at 12, her eye time is at 1, her FiO2 I'm going to change to 45, and her rise time at 0.1 seconds. I have her alarms. Her high pressure alarm is at 20, her low pressure is at 5. Her low pressure delay is set at 20 seconds, apnea at 20 seconds. Her low minute ventilation is at 12 liters per minute. Her high rate alarm is at 15 breaths per minute, and her low rate alarm is at 11 breaths per minute. I will continuously monitor her work of breathing, her heart rate, respiratory rate, and saturation, and I will obtain an ABG at 30 minutes after initiating the BiPAP therapy to check the effectiveness of the BiPAP, and I will make any changes if needed.